Here is the question that came in through that email. We've been noticing, and I assume that this is a team of people at a school, so we've been noticing that my student has a lot of trouble focusing and staying on task. He also gets really anxious and shuts down in new situations. Does this mean he might have both ADHD and an anxiety disorder? Should I be looking into more diagnoses to figure out what's really going on? Great question. First off, it sounds like this is a student. So if you are a teacher, guess what? It's great. You don't actually have to worry about what a diagnosis of a student is. That's not your job. And that's a great thing to know, is you don't have to diagnose them with anything. You can know that they need some support, but you don't have to know what their diagnosis is, and you don't have to try to create a diagnosis for them or try to come up with a diagnosis for them. But this is a question that comes up fairly often, especially about focus. And let me talk to you just about this idea of children being able to focus. There are so many different reasons why a child might have some difficulty focusing. And the number one reason that a child may have some difficulty focusing is because they think that whatever they're trying to focus on is boring. That's it. That's the number one thing. It's because they're children and it's hard to focus on things they find boring. As adults, we do the same thing. If we are listening to someone and that person just keeps going on, maybe some of you are feeling that way right now about me, and they're just going on and on and on and on. It can be really easy to tune out because we just don't find it engaging. We don't find it as something that we need to focus on. And that's the number one thing that makes kids not be able to focus. It's not ADHD, it's not anxiety, it's not trauma. It is just they're bored. They don't find whatever it is that they're supposed to be focusing on interesting enough to give focus to. That doesn't mean just let them not focus. We have to help them learn how to do that. But it could be that there's absolutely nothing going on. They're just bored, or they don't find this subject or this topic or even school in general engaging to the point where they want to pay attention to it. And that's okay. That means that they're a child. We have to find some ways to support them and help them find out their own reasons for becoming engaged, and we have to work on ways to engage them, all that. But it doesn't mean that there's something major going on. It doesn't even mean that there is a diagnosis. But let's talk about what you say. You say he also gets really anxious and shuts down in new situations. There's lots of reasons that could happen. It could be an anxiety disorder. It could be trauma. It could just be that this new situation that you see them in is difficult. It could be that they don't want to engage. It could be all sorts of different things. But really, it comes down to this idea of focus and ADHD and what all is going on there. And that is this topic of what we in the mental health world call comorbidity. Comorbidity, which means that a client is diagnosed with more than one thing at a time. In mental health, there is kind of a hierarchy of different diagnoses. There are diagnoses that typically show more symptoms or show more difficulties than other diagnoses, or that present themselves in many different ways rather than more regimented ways. So, in talking about focus, there are lots of diagnoses that one of the criteria is difficulty focusing. Let me name some of those diagnoses for you. Anxiety, depression, trauma, ADHD. That's just 4 different diagnoses that could cause someone to be having difficulty focusing. But in this idea of comorbidity, of having more than one diagnosis, you were asking about ADHD and anxiety. I would say, as a clinician, that yes, a client might meet criteria for ADHD, for instance. But if they have an anxiety disorder, I would believe that most of that focus difficulty or a lot of those ADHD symptoms were actually coming from anxiety, not a secondary disorder. The same is true with trauma or autism. I didn't mention autism as one of those diagnoses that has the symptom of difficulty focusing. Well, if a child has autism, I, as a clinician, would not diagnose them with autism and ADHD. I wouldn't diagnose them with autism and anxiety and ADHD. And sometimes clients come in to me and they have a long list of diagnoses of autism and ADHD and anxiety, all sorts of things just kind of all mixed together. And that can happen for a few different reasons. But to me, as a clinician, when I'm working on trying to help figure out where is the deep-rooted issue, not just these symptoms, I would say it's just complex autism. Or if a child has experienced trauma and they've been through some really difficult things, it could present as trauma and depression and ADHD and anxiety, but I would not diagnose them with all four of those things. I would just say it's complex trauma. Now, if we get the trauma resolved, if we get that diagnosis resolved or that issue resolved, and there's still some other symptoms, then I can move on to the next diagnosis. There are times where clients have to be diagnosed with multiple different things. One is in the case of receiving medication. There are certain medications that clients can only receive if they have specific diagnoses. For instance, there are some medications for ADHD that you can only receive if you have an official diagnosis of ADHD. So a psychiatrist may diagnose a child with autism also with ADHD because they need to give them a stimulant or a medication for ADHD that they can't give just because a child is diagnosed with autism. So they would have that comorbid diagnosis. But to me, as a clinician, as I'm trying to understand the root causes of things, it's just complex autism or complex trauma or even complex depression or complex anxiety or whatever it might be. I do my best to have a single diagnosis that is the best answer for the different symptoms that are going on. And I think that more clinicians need to do that. In the DSM, it's called the Diagnostic and Statistical Manual. It's the book that we use to diagnose clients with different things, and it has all the symptoms listed and all the different diagnoses, and if they meet the criteria for the symptoms, then we can diagnose them. But in every diagnosis, there's a line that says, unless these symptoms are otherwise accounted for through another diagnosis, either a medical diagnosis or a mental health diagnosis. To me, that sends a signal that we give comorbid diagnoses too often. If you have a child who has trauma and they're having difficulty focusing, it doesn't mean they have trauma and ADHD. It means that their trauma is causing them to have problems focusing. Hopefully that makes sense. You were asking about this comorbid diagnosis of anxiety and ADHD, and I would say that it sounds like from what you're describing, and I've not met this child, so I can't give an official diagnosis, but if they're shutting down in new situations and they're having difficulty focusing, and you can tell that they're overwhelmed by thoughts of different things, that sounds much more like anxiety that is presenting with some of the symptoms of ADHD, but not that comorbid diagnosis of ADHD and anxiety. Hopefully that answers your question. Again, I see it all the time where clients come in with a long list of things, but one of those things will be trauma. Well, trauma can present as so many different things, or they'll come in with a long list of things and one of the things is autism. Well, autism can present as so many different things, and we need to be reminded as clinicians there is that line that says, unless these symptoms are better accounted for through another diagnosis. Keep that in mind, clinicians, and keep that in mind, parents and caregivers, as you are working with your children and working with the clinicians who are working with your children. Oftentimes it's not 6 different things, it's one very complicated thing that's presenting in 6 different ways. Or it might be 2 things that are presenting in 6 different ways, but not 6 different major problems all going on all at once. And that can seem overwhelming if your child is diagnosed with autism and ADHD and anxiety and depression. And it's like, oh my gosh, which one are we supposed to tackle? Well, really, it's autism. It's autism that's presenting in all these other ways. Or if your child has experienced trauma, and that's already overwhelming. So they're diagnosed with trauma and anxiety and depression and ADHD. And so what are we working? We're working on trauma. It's just presenting in a lot of different ways. Great question. Thank you so much for writing in.